Welcome to LCC's HIV/AIDS awareness training. As a child care provider at Lower Columbia College, you must complete this HIV/AIDS training in conjunction with bloodborne pathogen prevention training. This course covers the prevention, transmission, and treatment of HIV/AIDS along with confidentiality laws you must abide by. So what exactly is HIV/AIDS? HIV is an abbreviation that stands for Human Immunodeficiency Virus. HIV is a virus that first infected humans in the late 1800s to early 1900s in Africa. This virus has spread throughout the world since its discovery. HIV attacks the human immune system, specifically the T cells, which are responsible for organizing many aspects of the immune response. As the T cells are destroyed, the suppressed immune system can no longer fight off infections and/or cancers. The photograph on this slide shows a healthy T cell on the left and a T cell infected with HIV on the right. Now that we know HIV is a virus affecting our immune cells, we can talk about AIDS. AIDS is an abbreviation that stands for Acquired Immunodeficiency Syndrome. AIDS is the final stage of HIV infection, and not everyone who has HIV advances to this stage. AIDS is the stage of infection that occurs when your immune system is badly damaged and you become vulnerable to opportunistic infections. Without treatment, people diagnosed with AIDS typically survive about 3 years. Once someone has a dangerous opportunistic illness, life expectancy without treatment decreases to about 1 year. HIV and AIDS are common diseases. 36.9 million people are infected worldwide. According to the CDC, there are approximately 1.1 million adults in the United States living with HIV, and approximately 20% of those are undiagnosed. Children can and do become infected by exposure to adults. The U.S. Department of Health and Human Services reports that there are 2.6 million children living with AIDS worldwide, and most of these children become infected by exposure to their HIV-positive mothers during childbirth or breastfeeding. It is important that we each understand the ways HIV can be transmitted. Having a solid understanding of the routes of transmission helps prevent infection and reduces misconceptions about the potential for infection. The most common routes of transmission include having anal or vaginal sex with someone who has HIV, sharing needles or syringes, rinse water, or other equipment used for injections with a person who has HIV, from mother to child during pregnancy, birth, or breastfeeding, or by being stuck with an HIV-contaminated needle or sharp. This list includes other possible routes of transmission, although they are very uncommon. Please take a minute to read through them. You cannot get HIV from the following: mosquitoes, ticks, or other insects, saliva, tears, or sweat that is not mixed with the blood of an HIV-positive person, hugging, shaking hands, sharing toilets, sharing dishes, or closed mouth or social kissing with someone who is HIV positive. Other sexual activities that don't include the exchange of body fluids, for example, touching. So how do we prevent HIV infection? Today, more tools than ever are available to prevent HIV. In addition to limiting your number of sexual partners, never sharing needles, and using condoms, you may be able to take advantage of newer medicines such as pre-exposure prophylaxis and post-exposure prophylaxis. Additionally, you should always use universal precautions when handling blood or other potentially infectious material. Now let's talk about how HIV is treated. HIV is treated using a combination of medicines to fight HIV infection. This is called antiretroviral therapy, or ART. ART isn't a cure, but it can control the virus so that you can live a longer, healthier life and reduce the risk of transmitting HIV to others. ART involves taking a combination of HIV medicines, called an HIV regimen, every day exactly as prescribed. These HIV medicines prevent HIV from multiplying, which reduces the amount of HIV in your blood. Having less HIV in your blood gives your immune system a chance to recover and fight off infections and cancers. Even though there's still some HIV in the body, the immune system is strong enough to fight. By reducing the amount of HIV in your body, HIV medicines also reduce the risk of transmitting the virus to others. ART is recommended for all people with HIV, regardless of how long they've had the infection or how healthy they are. If left untreated, HIV will attack the immune system and eventually progress to AIDS. HIV/AIDS has been like any other public health issue of our time. The epidemic began in a cloud of fear. At first, no one knew how it was spread. When it became clear that HIV was infectious and it was potentially fatal, there was no treatment. This led to widespread stigma and discrimination against people living with HIV/AIDS. In response, public health officials worked tirelessly to provide the general public with accurate information about how HIV was and was not transmitted, and how people could protect themselves. Public health officials realized that the stigma attached to HIV/AIDS was getting in the way of testing and prevention efforts and keeping them from getting health care. Despite the best efforts of public health officials, medical professionals, HIV/AIDS advocates, and people living with HIV/AIDS, HIV-related discrimination continued. People living with HIV/AIDS, and even some people who were merely rumored to have HIV, were fired from their jobs, evicted from their homes, and denied access to medical care and social services based on their HIV status. After years of widespread discrimination, Congress passed a series of federal laws to protect people living with HIV/AIDS, giving them the same legal protections as any other person with a medical disability. These federal laws include the 1990 Americans with Disability Act, or ADA. According to the ADA, HIV infection meets the definition of a disability and is therefore protected from all forms of discrimination. A few years later, Congress enacted another important legal protection, the Health Insurance Portability and Accountability Act of 1996, or HIPAA. HIPAA is designed to protect the privacy of patients' medical records and their other health information. It also provides patients with access to their medical records and significant control over how their personal health information is used and disclosed. HIPAA has proven to be very effective in preventing discrimination against people living with HIV/AIDS by preventing others from knowing their HIV status. For further information regarding HIV/AIDS, we recommend you explore the U.S. Department of Health and Human Services webpage at www.aids.gov. To complete this course, please take the quiz located under the Quiz tab and post any questions under the Discussion section of this Canvas course.